Wound healing is a complex biological process. For chronic wounds, this process is often disrupted, leading to prolonged suffering and increased healthcare costs. In the past, treatment options for such wounds were limited, often involving painful procedures and lengthy recovery periods. However, a new era of wound care has emerged with the use of amniotic allografts. These biological dressings, derived from the amniotic membrane, offer a safe and effective way to promote healing in even the most challenging wounds. Amniotic allografts are essentially tissues taken from the amniotic sac, which surrounds and protects the baby during pregnancy. This membrane is a rich source of growth factors, collagen, and other bioactive molecules that play a crucial role in tissue regeneration. When applied to a wound, amniotic allografts act as a biological scaffold, providing structural support and stimulating the body's natural healing mechanisms. They also create a protective barrier against infection and reduce inflammation, creating an optimal environment for wound closure. The use of amniotic allografts in wound care is revolutionizing the way we approach these challenging cases. By harnessing the body's innate healing potential, these allografts offer a promising solution for patients struggling with chronic wounds, providing them with new hope for a faster and more complete recovery. One type of amniotic allograft commonly used in wound care is dehydrated human amniotic membrane allograft, or DHAM. The application of DHAM is a relatively straightforward procedure that can be performed in a clinical setting. Before applying the DHAM, the wound bed is prepared using standard wound care practices. This typically involves cleaning the wound with a sterile solution and removing any dead or damaged tissue. Once the wound bed is prepared, the DHAM is carefully applied to the affected area. It is essential to ensure complete coverage of the wound with the amniotic membrane. The DHAM is then covered with a protective dressing to keep it in place and maintain a moist wound environment. The frequency of DHAM application may vary depending on the severity of the wound and the patient's individual healing progress. In some cases, multiple applications may be necessary to achieve complete wound closure. Regular follow-up appointments are crucial to monitor the healing process and make any necessary adjustments to the treatment plan. The physician will assess the wound at each visit and determine if reapplication is required. Amniotic allografts offer several advantages over traditional wound care methods. One significant benefit is their ability to reduce inflammation. Chronic inflammation can hinder wound healing, but amniotic allografts possess anti-inflammatory properties that help to calm the inflammatory response, allowing the body to focus on repair and regeneration. Another key advantage is their low immunogenicity. Because amniotic allografts are derived from human tissue, there is minimal risk of rejection or adverse immune reactions. This makes them a safe and well-tolerated treatment option for a wide range of patients. Furthermore, amniotic allografts are shelf-stable, meaning they can be stored for extended periods without losing their biological activity. This shelf stability makes them readily available when needed, simplifying wound care logistics. The combination of these benefits makes amniotic allografts a valuable tool in the field of wound care, providing a safe, effective, and convenient way to promote healing and improve patient outcomes. The journey of an amniotic allograft from donation to application is a meticulously controlled process. Amniotic tissue is typically donated by healthy mothers who undergo planned cesarean sections. The donation process is strictly voluntary, and donors are carefully screened for any infectious diseases. Once donated, the amniotic membrane undergoes rigorous testing and processing to ensure its safety and efficacy. The processing takes place in specialized laboratories that adhere to strict quality control standards set by regulatory agencies. During processing, the amniotic membrane is cleaned, sterilized, and often dehydrated to preserve its biological properties. The final product is a sterile, biocompatible allograft that is ready for use in wound care. The stringent processing and quality control measures ensure that amniotic allografts are safe and effective for patients, minimizing the risk of complications and maximizing the chances of successful wound healing.